Okay. Hello, everyone, and welcome to this Ask Me Anything live stream webinar. We have Amber and Michael, who are DPT students with us, and they're going to answer questions for us about physical therapy school. My name is Laura Turner, and I am the Executive Director for the Health Professional Student Association, which publishes the Student Doctor Network forums. Our mission is simple. We help students from underserved communities increase their chances of admissions to health professional school. And we do this by offering donor-supported guidance, advising, and assistance to students, regardless of their background or financial means. We invite you to check out all the donor-supported resources we have available at studentdoctor.net. A few housekeeping items before we get into the webinar. First, this live stream is being recorded, so you will be able to go back and rewatch it or forward it to a friend who might not have been able to attend. Also, to submit a question, enter it in the comments section of YouTube or Facebook, wherever you're watching it, and we'll pull it up on screen for Amber and Michael to answer. So with that, I'm going to go ahead and start to turn it over to Michael and Amber. They are second-year Doctor of Physical Therapy students. They both have undergraduate degrees in biology with a concentration in health professions, and they can answer questions about the application process, interview questions, tuition and financial aid, their day-to-day schedules, managing stress during physical therapy school, their study habits, and also any couple-related questions about attending the same program. So with that, I will go ahead and turn it over to them. Thank you. Okay, so we'll go ahead and get started with the first question. So when did you each decide first to become a physical therapy, and why did you make that decision?
So I'll go ahead and get started. I first wanted to go to physical therapy school when my best friend had a spinal cord injury. I was with him every single day throughout his rehab process. I was able to sit on a lot of his treatment sessions, and I saw the impact that physical therapy had on my friend's life. And from that point, I just wanted to go to physical therapy school so that way I can one day make that same impact on someone else's life as well.
So the kind of similar situation with myself, I was there during our friend's injury and his recovery process as well. But I first decided to become a physical therapist when I myself tore my ACL. So I was a sophomore in high school when that happened. So going through the recovery process really pushed me to know that this is what I want to do. I always knew I wanted to be in the healthcare field. I just wasn't quite sure what. But going through that rehab process is really what directed me to physical therapy.
Great. How and why did you guys choose the school that you currently attend?
I guess I can go first on this one. So for MCPHS, one of the big kind of directors that allowed us to pick this school over another school is the curriculum. I think that the layout of the curriculum and how they have all of the didactic work in the first 2 years, and then the clinical application in the clinicals in the last year was something that really interested me. I know for myself, I would rather just kind of get the first two years of hard work done and then have an entire year of clinicals rather than kind of having some schoolwork and then going away and then coming back. I feel like that was just too difficult of a situation. So that's something definitely to look at if that's something that you're interested in. Definitely look at the curriculum, but that's really what kind of honed in on this school for me.
And kind of piggybacking off of what Amber said, we have a pro bono clinic at our school, and from day one, you're in the pro bono clinic. You're working with patients from our community. You're getting that hands-on experience to complement your in-person learning. And I think that that was a big plus for me because it allows me to use all of the material that I'm learning in school and apply that to a real life patient.
Cool. What has surprised you most about your studies?
So I'll go first on this one. What surprised me the most was the change in my study habits from undergraduate to the graduate level. I think in undergraduate, I was more of the procrastinator, and I quickly realized in PT school that that just wasn't going to cut it. You need to really retain the information from one class to another. It doesn't go away. One semester kind of builds on another. So I think what surprised me was my ability to adapt to the constantly changing environment. Going from a procrastinator to someone that does assignments a week early.
So kind of a similar situation with me. I've always been very organized and very on top of my work. So I wouldn't necessarily call myself a procrastinator, but there was definitely some nights in undergraduate where it was some last minute studying. But just really, like Michael said, changing your study habits. I was always going into PT school. I'm never going to change the way that I study. I know this is how I study. This is how I learn. And it is a 360-degree turnaround. I have completely changed the way that I've studied. I honestly can't even tell you how I used to study in undergraduate. So it's just, don't be afraid to make changes in your study habits. And if your study habits aren't working, don't just try to stick to those habits. Make sure you make a change and really find a way that you learn in PT school, because it can be different than undergraduate.
So what are some of the tactics or methods that you use now that you're in PT school to do your studying?
So I rewrite all of my notes. I am not a person who can study off of PowerPoints, and unfortunately, a lot of professors use PowerPoint as their method of instructing. And it's very hard for me when content on the same material is on multiple different slides. I'm not able to connect that material. And it's a lot of material. So I basically type out all of my notes. I highlight and underline the important information in different colors. So I kind of color code different things. And then my main change in what I do now is I have one blank document, and I, like 2 days before the exam, I write all of the very important concepts and study most of the major important concepts. And then I relate to my typed notes to get all the fine details. But there's just so much content that if you just look at every single line individually and try to, whether it's memorize or just understand it, it doesn't really work that way. You just kind of need to have an overall picture on a lot of things and then hone in on the details when it's necessary.
I totally agree. And I think the biggest thing for me is now I try to study in groups versus I used to study by myself during my undergraduate career. And I also changed the way that I study. I used to try to memorize everything on the piece of paper and apply it to an exam and kind of forget about it afterwards. In PT school, it's more about understanding the material, because the material does transfer from one class to another, and it's extremely important to understand it versus to memorize it and understand why things happen and the way that they happen, versus try to memorize it for an exam, because unfortunately it's not something that ever goes away.
Thanks. Yeah, thanks for the additional detail there. I think students sometimes aren't prepared necessarily when they move from one level to the next level in a school. So we'll hop on to the next question here, which is, if you had to do it all over again, would you still choose physical therapy school? Would you still want to continue down the path that you're currently on?
Yes, 100%. I think that physical therapy is not one of those fields that you go into for financial reasons. It's not one of those careers that you just kind of choose secondhand just because you want to and you don't know what you want to do with your life. And physical therapy is one of those things where if you're going to physical therapy school, you need to have a love and a passion for helping people and for just physical health in general. Because if you don't enjoy what you're doing, you're not going to enjoy studying, and you're going to have a really hard time in PT school. It's not a career that you just choose just to choose. So if PT is your passion, it's hard. But if you truly love helping people and want to do that by means of physical therapy, it's 100% the way to go.
I 100% agree. I would do it all over again. I think the patient experience is amazing. You get to spend one-on-one time for an hour with your patients, and not a lot of healthcare professionals have the ability to do that. I know a lot of my friends that are going to medical school, you're kind of in and out with your patient, versus physical therapy. You really get to make an impact on their life, their family's life, and you get to know them on a personal level, which is amazing.
Cool. We have our first question from the audience here. I'll pull it over. So Samantha asks, what excites you most about your clinical practice? Now, I know you mentioned that you do right now you're in the midst of your classwork, but what do you like best about the clinical practice aspects?
So I like the fact that I can integrate exactly what I'm learning into working with my patients. So, for example, we had kinesiology and we had orthopedic pathology, and learning all those different concepts and then going into our pro bono clinic and be able to apply those concepts is extremely rewarding.
So for me, I actually have already set up one of my clinical sites. So I'll be attending a pediatric clinical in Maine in October of next year. So I think just having that site already set up is something that I'm really interested in. And it kind of pushes me further to just make sure I'm doing like all of the work that I need to do to make sure I get to that point in school. But I think the most important thing, kind of like Michael said, is really just being able to apply everything that you're learning in school and actually seeing an outcome of it. Because in regular classes, you get tested on the material and all of that, and you're able to see kind of how much you know, but you really won't know how much you truly know and retained until the clinical practice. And so I think that's just something that I'm really excited about, is just to get out there and really apply what we've learned.
Great. Has PT school met your expectations, and why or why not? And maybe what were your expectations going in? Did you have expectations of what it would be like?
So I think this is a little bit of a tricky question in the sense that when we started PT school, we kind of started in the midst of COVID. So it has been a little bit challenging with the online learning. Luckily, our program was really great about getting us lab time and on-campus time to really allow us to do the hands-on work that we need to do as physical therapy students. So in that sense, I definitely think that PT school has met all of our expectations. I think the one, it's definitely a lot of work, and sometimes I feel like it may have been more work than I really was anticipating in certain classes or in certain semesters. But for the most part, it has definitely met my expectations. And I wouldn't say that there's specifically one thing that I'm like, wow, this is really what it was supposed to be. Like, I didn't know that it wasn't like that for me.
I totally agree with what Amber said. PT school, going into it, I knew that it was going to be extremely hard. And don't get me wrong, it has been extremely hard. But at the same time, it has been extremely rewarding to see how far I've come and how far my class has come as a whole in comparison to day one.
That's a good way we can transition into the next question, which is, what do you like most about PT school?
I like the connections that I've made, both with my instructors, with members of our community, with our classmates. These are connections that I'm going to take with me for the rest of my life. My instructors have been extremely helpful. I almost feel like I can go to them with anything. I've talked to them about personal problems and school-related problems. So I just like the fact that I've made connections that I'm going to have with me for the rest of my life.
I would definitely second that. I think our program, specifically with our professors, they're very easy to come to. And that's something that I find extremely important to have in a program, because it is a challenging thing. And sometimes you're going to be overwhelmed, and sometimes you just need that figure to talk to. but more specifically, what I like about PT school, kind of like Michael was mentioning, is since we have our pro bono clinic, that's a small way to kind of incorporate what we've learned thus far into the clinic, or the clinical work so far. So that's something that, if that's an important factor to you, then definitely finding a school with a pro bono clinic is something that you should kind of keep on your radar, because it allows you that hands-on experience early on, and allows you to just kind of build your confidence, because the first time you seeing patients, you're nervous, you're anxious, you don't want to mess up, but really having the pro bono clinic allows you to work with patients while still being supervised. And I think that's really important.
Well, the obvious follow-up to the what do you like best is what do you like least about PT school?
I guess I'll go first on this one. I think the only thing that I can say about what I like least is you just have to make sacrifices. There's certain times in your life where you may have personal things going on. You may really just, I want to go out to dinner with my family, or I want to spend time with my friends, or whatever it may be. You just really need to be willing to make sacrifices. And that's a hard thing with physical therapy, with any school in general, but physical therapy school specifically, because it is so taxing and demanding that you just kind of need to be able to make those sacrifices even when you don't want to at sometimes.
Yeah, just to piggyback off of what Amber said, you're going to miss weddings. We've missed weddings. We've missed birthday parties. We've missed hanging out with our friends when everyone else is getting together. But all of these things that you're missing out on are going to be extremely, you're not going to regret it later on. Exactly what Amber said. All of these sacrifices are extremely worth it.
They're all building towards what your goal is to become a physical therapist. So I did want to remind people that if you have any questions that you'd like to ask Michael and Amber, that you can enter them into the comment section of YouTube and Facebook, and we'll be able to pull them up on screen for them to review. Now we're going to switch over to a question about what your typical day looks like. What is it like what are you doing in a typical day at school?
So our typical day starts out with us waking up at around 8 o'clock, or a little bit earlier, like 7, because we have 8 a.m. classes some days. So we'll get ready. Our school does have a dress code, so we'll get dressed. We'll go to school. We live about 5 minutes from school. Once we get to school, we have a lecture in the morning usually, and then we'll have a little bit of a lunch break, and then we'll have our lab. And then some days we have multiple labs in a day. For example, we had that today, where one half of our cohort is going to be in one lab before lunch, and the other half is going to be in another lab. And then we have a lunch break, and then we switch. So we'll go to the other lab, and then they go to the other lab. I know that sounds kind of confusing. And then after that, we come home. We usually walk our dog for about an hour. We have dinner. We try to relax for a couple hours. And then we do homework. We study for exams, any assignments that we have coming up. And that's pretty much it.
Yeah, kind of like Michael said, I really think one important thing to kind of build into your daily schedule is really some time for yourself. Even on days where you feel like you have no time to do anything and no time to take a break, even just getting out of the house for 30 minutes, it's not going to kill you at the end of the day. I mean, it could help you learn maybe one other concept, but really you kind of need that mental relaxation, especially after being in the classroom or in the lab for 8 hours a day. But pretty typically most days we're 8 a.m. to 3 to 5 p.m. depending on the day. So it is generally a pretty full day. Michael and I don't work outside of school. I know some of our classmates do. Some of them work during the week. Some of them work on the weekends. That's not something that I necessarily would recommend in at least your first semester, maybe even your first two, because you're trying to kind of get the hang of things. But for the most part, it's we're Monday through Thursday. So we are lucky in the sense that we do get Fridays off, but our Fridays are when we go into the pro bono clinic and when we go out to other hospitals and clinics for observations. So some days you have Friday off, some days you're in the clinic observing or working in the pro bono clinic. But it's pretty packed Monday to Friday.
So on average, how many hours a week? Well, you kind of already touched on this a little bit, that it's 8 to 3 or 4 each day. How many hours do you study? So you're doing like what? I can do math there. 7 or 8 hours of work each day, and then of school each day rather. And then how much study time is there most days?
So it really depends. Michael and I do a lot of our studying on the weekend. And that doesn't negate the fact that we do study during the week, but a majority of our hardcore sit down study time is during on the weekends, because like I said, after 8 full hours of class, you're just very mentally tired. So we generally take a break. If we get out of the classroom at 4, we generally take a break until about 7 o'clock. And that includes like dinner, relaxation, walking the dog, and that kind of stuff. But then around 7:30, we'll get back on our computers at our desk or whatever we need to work on. And I would say it's a guarantee until at least 10 o'clock. If you have the exam the next day, sometimes you might be up until 12, 1 o'clock in the morning. But on general, I would say at least 3 hours a day during the week. And then pretty solidly most of the day on the weekend. And that's not necessarily like only studying. When I say the weekends are pretty packed, there's a lot of group projects, there's a lot of assignments, a lot of discussion boards, and those kind of assignments that kind of take up the time. So it's not just full on reading notes, studying notes, all of that. It's kind of incorporating everything. But you definitely take time to yourself as well.
On that note, do you feel you have enough time to spend with your family and friends? And why or why not? You touched on this a little bit, that it sounds like you're deliberately making a sacrifice now, knowing that that's going to be part of becoming a physical therapist. What's your feelings on that right now?
So it's kind of difficult because my family lives in New Jersey and Amber's family lives in Colorado, and we currently live in Massachusetts for school. So we try to see our family, once every 2 months. Whenever we have Friday off, we'll drive home and see my family. We have made a lot of friends since we've been here, mostly at the dog park. And we try to go out to dinner with them on a bi-weekly basis at least. So we do have time outside of school to hang out with our friends and family. Again, just having our family live so far away from where we currently are makes it a little bit difficult, but we call them every day. So we still have a lot of time for that.
And I definitely think it has a lot to do with time management as well. If you manage your time appropriately on breaks from classes or the weekend and you get a lot of stuff done, there's definitely room to hang out with your family and friends. Like Michael said, we go out to dinner pretty frequently with friends. For us, it's kind of easy because we go to the park and that's where we see our friends and hang out with our friends at the dog park. And like I said, we do that every day. So that's not something that it's impossible. You're definitely able to spend time with family and friends. I think the most important thing is you just need to manage your time well in order to get that time to spend with your family.
Cool. Well, let's switch gears a little bit now and talk about advice that you would give yourself if in your position now, knowing what you do know now. What would you say to yourself back when you started PT school?
You can do it. I think confidence is a big thing in PT school specifically, especially in labs when you're doing skill checks in different lab work. One thing that I've noticed is some students definitely lack that confidence. don't be afraid to ask questions. Don't be afraid to put yourself out there. If they're asking for someone to demonstrate something, don't be afraid that you're going to get it wrong, because at the end of the day, if you get it wrong, you're only going to learn from that experience. So be confident in yourself, be confident in your abilities, and just know that you can do it. There's definitely times where I'm sitting here, I'm like, I can't do this anymore. Like, it's so tiring, but just know that every day brings a new challenge, but with every new challenge, you learn something new, and that's the most important thing.
I think Amber said that extremely well. I also think the biggest thing was I was extremely worried about getting the same grades that I got in undergrad, and being the best and all that. And in PT school, it really doesn't matter. As you're there for a reason. Your professors know that you can do it. You're not going to get an A in every class, and that's okay. And I think the biggest thing for me was worrying and stressing myself out. I got an 80 on this exam. I don't know how I'm going to get an A in the class now. And it took me a little while. And I think looking back at it, I would tell myself that, don't worry about it. It's just a grade. Keep moving forward, and everything is going to be okay.
Cool. I want to mention again that we are accepting questions. If you have questions that you want to ask Amber and Michael, you can enter them in the comment section of YouTube and Facebook, and we can bring them over on screen. So please ask questions. They've been generous enough to give us some time. And I want to point out that they have an exam tomorrow. So not only did they give us some of their time, but they did give us some of their time before an exam. So we really appreciate them taking the effort, making the effort to answer questions for folks. So please make use of that and submit some questions for us. I'm going to go ahead and do another kind of a shift of gears to a question about healthcare today. From your perspective, what is the biggest problem with healthcare today?
I think based on where you live, I think access to healthcare is sometimes an issue. I'm not sure if it's the same everywhere. I really wish it was, because everyone is entitled to healthcare, obviously, and you shouldn't have to drive 45 minutes to seek healthcare services. I think it should be more readily available especially in underserved communities. And I think the biggest problem as well is pro bono work. I think there needs to be more of that, and to give back to our community. And I'd like to see more of that happen.
Yeah, I definitely think, kind of like Michael was saying, accessibility is a big thing, and that's something that we have done multiple projects on throughout our schooling so far, is determining based on the size of the town how many PT clinics there are and what their accessibility is, and do they only accept insurance? Are they a cash-based physical therapy clinic? Do they allow pro bono work? So really a big thing is just accessibility. And then with insurance as well, physical therapy is grouped with speech therapy under those services within the healthcare field, or within the health insurance field. So a big thing is you kind of have to work around the amount of hours that you are approved for. They may only approve you for 10 visits, and you have to determine how you're going to get that patient back to what they want to do in 10 visits. And if you don't, then you need to submit paperwork and documentation in order to hopefully get more visits. And even then, you don't know if you're going to. So I think just overall, it's very challenging to have patients in the clinic, especially patients who need it. And that's a big thing.
Now, you've both mentioned the pro bono clinic that you guys have through your school. Can you talk a little bit more about that and any other types of outreach or volunteer work that you do?
Yeah, so I can kind of go first on this one. So within our PT program, Michael and I are part of a bunch of different clubs. Michael is the president of the Student Physical Therapy Club. I am the treasurer for that club, and I'm also an event coordinator for the service club at our school. So this past year it has been a little bit challenging with COVID and kind of the restrictions on that. So volunteer work has been a little limited. However, our program does work with our community a lot for different volunteer events. There's a veterans event that we're going to be hopefully getting set up pretty soon so we can go and help to teach different exercises to those veterans. We do it's called an angel tree project, and that's where a bunch of students in our program come together to buy gifts for children whose parents are unable to buy them gifts for Christmas. So our school specifically is big on volunteer and service work and trying to help out our community as much as possible. But it has been a little bit challenging, like I said, with COVID, but hopefully with this upcoming year, we're able to put some good events together for volunteer work.
What's your advice for students who are interested in pursuing a career as a physical therapist? Maybe talk a little bit about what the admissions process was like and what the factors you should think about as you look to this career.
So talking a little bit about admissions and picking a school, I definitely think it's important to look at the curriculum of the program, talk to current students in the program, talk to faculty members of that particular program. Just make sure that that is a place that you really want to go and you want to learn. I think that's extremely important. And some advice would be follow your dreams. You know, you can do it. Don't let anyone tell you that you can't. You know, we're living proof of that. We have overcome, you know, a lot to make these dreams a reality. And, you know, just follow your dreams and you can do it.
Yeah, I think another thing, an important thing about admissions and interviews and everything like that, be yourself. They don't want you to walk in there and be some fake person and give them the answer that you think they want to hear. They want to know and learn you, because at the end of the day, if you go to their program, you're going to be with them for the next 3 years. So be authentic to yourself, answer it as truthfully as you possibly can, all of the questions. Don't just say something that they want to hear, because they're able to pick up on that. They've done interviews for a long, long time. They know the answers that students are just going to give just because they don't know what else to say. But just really be yourself. And as far as like pursuing a career as a physical therapist, like I said, it really just needs to be in your heart. This has to be a career. It's not easy. You see patients with conditions that are heartbreaking. And so you really just need to have it in your heart. And if you don't, then it's not an easy field to pursue. So you really need to just mentally be there and want to do it.
We have another question that came in from Samantha, and it's, why is character such an important piece of becoming a physical therapist?
I think Michael can speak to this a little bit more than I can. We've both previously worked at a rehabilitation hospital. I worked more in the outpatient department and he worked more inpatient, but you are going to get some difficult patients. You are going to get patients who don't believe anything that you say. You're going to have patients cry on your shoulder because they had a stroke and they can't work anymore and they can't walk and you need to be a strong character and someone who can allow them to express their feelings and also respectfully and appropriately guide them through their recovery process. So Michael, he probably has an example of this, kind of what he experienced at the hospital. And this is kind of a story that he always tells to everyone. But character is just, you need to have somewhat of an outgoing personality, because like I said, you're going to get patients of all different everything, all different everything. That's all I'm going to say about that. You're just going to get a bunch of different patients, and it's important that you're able to kind of mold your character to whatever kind of patient you're working with.
Yeah, piggybacking off of what Amber said, I think it's extremely important to be, very a tough individual emotionally, because when I worked on the spinal cord injury unit, it was important for me to be tough for these patients so they can come to me. It's also important to be humble and understanding, because a lot of the patients that I've seen just experienced a life-changing event, and you are the first person that they're seeing after that event. And it's important to be there for them, both physically, emotionally, and just be very understanding. And it's important to also be able to go out of your way to make someone's day. Something as little as bringing them a cup of water. I've had people cry telling me, "Thank you so much for bringing me a cup of water." It took me about 30 seconds to go grab it, but it really made their day. And I think it's important to also put yourself in that patient's shoes. They just experienced a traumatic injury, and, put yourself in their shoes. What would I want for someone else to do for me to help me overcome this? And I think that's extremely important.
Thank you. And I just want to remind everybody again, if you have questions, you can put them into the comment section of YouTube and Facebook, and we'll pull them on screen like we did for Samantha's question here. I'm going to switch now to talking a little bit about what it's like being a couple within the same program.
I think it's great. We get asked this question a lot, both from students in our program and students that are touring their school. I think it's great because she understands the stress that I'm experiencing, and I understand what she's going through. And I think that if you're not in the same program, sometimes it can be a little bit difficult to see what the other person is going through. It's good because we have totally different study habits, so we kind of blend them both together, and we've had very good success with that. And sometimes it is a little bit difficult because, like I mentioned, there are some rough days, and you do have strong feelings, and there's a little bit of arguing going on, but overall, I think it's a great experience being able to go through it with her.
Yeah, so I completely agree with that. There are definitely days where you're challenged not only as a student but as a couple. I think one extremely important thing is to not compare yourself to one another. Michael and I both have very high expectations for ourselves and for each other as far as grades go on exams. But it's really important to not be like, oh, well, you got an 86 and I got an 82. And at this point, it doesn't matter. As long as you both are succeeding and as long as you both are pushing each other to be the best that you can be, that's extremely important. There are definitely challenges in the sense that some people in the program may think that you only do things together and you're always together and all of this. And one thing that I will say to that is it's extremely important to branch out as your own individual and make your own friends and be able to spend time apart. Because like I said, we are spending, in a sense, every waking hour together by the time we're in class and in lab and everything. So it can have its challenges, but it's extremely rewarding to see someone who you care about so much succeed and do what they love. And that's one of the most important things. And it's hard. It may be challenging to get into the same program. Michael and I had good success with that. So I think it's definitely possible, but just remember you're your own person at the end of the day as well.
Another question from the audience here from Samantha. Are you looking at doing a residency? When should students start looking into those options?
So I myself, I'm kind of tossed up in the air. I'm not 100% sure. I know I want to pursue pediatric physical therapy. And because I already have a clinical in pediatric physical therapy, I don't necessarily think I need to do a residency. also for residencies, from what I understand and information that I've gained, a lot of them have to do with inpatient experiences, and I am really trying to stay towards the outpatient pediatric department. So for me, it's not something that I'm heavily looking into. It's definitely something that I'm considering, but that wouldn't be until third year. So like I said, we're just about to start our second year. We're just finishing up first year here in a couple weeks. So definitely not looking into that for another year or so, but it's something to keep on your radar, especially if you're interested in, like what Michael's interested in is SCI, and he can kind of go into that a little bit more, but it just depends on what your interest is in, and if it's something that can extremely benefit you, or if it's just something that it's good to have, but don't really need it. So he can talk a little bit more on his aspect of that.
So my heart and soul is in neuro PT, specifically spinal cord injury, and I am actually planning on doing a residency to get my NCS eventually. And the reason why I want to do a residency is because you have that one-on-one mentorship with a therapist who has been working with that population for a long period of time. And a lot of things that they can teach you, you may have not learned in school, or you may have not really gone over it. And I think that that clinical experience from that clinician can really shape you as a clinician yourself. And I think students should start looking into these options their second or third year, when you're really getting into the clinical aspect of your coursework, and just see if residency is something that you're interested in. Maybe get some more information from the various programs that do offer residencies. I know there's a lot. There's orthopedic residencies, there's neuro residencies, there's pediatric, sports. There's a lot.
Okay, and I'm going to have a question here about applying to physical therapy school and interview questions. Now, Amber, you had talked a little bit about being yourself in the interview. What types of interview questions should people applying to physical therapy school anticipate?
So there's a wide variety, and I think some questions may surprise you. I know there are some questions that I was like, oh my God, I didn't even think about this. I had no idea what I was even supposed to say. I think the general questions of, why do you want to be a PT? Tell me a little bit about yourself. Kind of just the basic questions you're going to get at every PT interview you go to. Now, some people are going to be, you're writing a book tomorrow. What is the title and why? What is your book going to be about? So there's definitely some questions that are kind of out there and something that you wouldn't expect. But again, with those questions, it's just important to be yourself. And if you don't know what to say, make something up. But when you make it up, make it true, but make it about yourself. You don't want to ever like say some like far-fetched answer just because it's like maybe what they want to hear. You don't want that. You want to be authentic to yourself. But Michael, he has more experience with like different interview questions. This is something that he's looked into heavily. I will say that Student Doctor Network was a great place for us to kind of look and see what kind of questions are asked at what school. So if you follow different forums about different schools that you may be interviewing at, some people are definitely open to sharing interview questions, and that's a great place to look, but just depends on the school.
So back to kind of what Amber said, there are the basic questions, why do you want to attend our program? And that has a lot to do with you doing research on the program prior to your interview. We've also experienced a lot of group interviews, and those are mostly to see how you can communicate with others. And a lot of physical therapy is communicating with others and working as a team to achieve a common goal, and that common goal being your patient. So those types of interviews, be yourself. Like Amber mentioned before, just communicate with others well, because that's what they're looking for. They're not really looking for a right or wrong answer, because there is no right or wrong answer. and just communicate well with others. There have been some questions, like Amber mentioned. My first interview, someone put a pen on the table and asked me to sell them that pen, and I was not expecting that, but I tried my best. There's no right or wrong answer, so just speak what's on your mind and always be yourself.
Great. Any other advice that you have for students who are looking into going to physical therapy school? And I apologize, hearing my kids a little bit outside. Hopefully I can get them to quiet down a little bit here.
That's okay. I will say one thing, application process wise, depending on the number of schools that you're interested in applying to, you definitely want to get started on your applications early. I know for Michael and I, we throughout undergraduate took a lot of different summer classes and we're pretty busy with those. But once school starts in September with your full semester, it gets pretty hectic with you trying to write essays and do all of your inputting of grades and everything. It can get a little time consuming and stressing. So take a couple hours a week during the summer and really start getting your applications complete, because it can get really challenging and it can get really time consuming. And another thing that I kind of learned that's important is when you're inputting grades, it's important to input them exactly as shown on your official transcript. So one thing that was recommended to myself from another student is to get an official transcript from your school and input the course title exactly how it has it on there. So for example, if you are taking anatomy and physiology and it has it abbreviated anatomy and phys, you want to put it exactly how it is on your transcript. So that's something that sometimes they'll like deny the course or make you like resubmit something. And when you're applying to so many schools, you don't want to have to go back and make edits and anything. So I think just inputting that information correctly the first time with the official transcript is definitely beneficial.
And make sure that you apply early as well. Don't wait until the deadline of November 15th to submit your application. Make sure that you apply, the sooner the better. And also, don't be afraid to go outside of your comfort zone. I know a lot of people would like to go to school in their home state, and I totally understand that, but don't be afraid to apply to other programs. You will have to make some sacrifices with that, but I promise you that it's all worth it.
Because at the end of the day, if you spend 2 years applying, that's 2 years that you're just kind of wasting your time instead of just spending those 2 years maybe a little bit farther from home. And just having 1 year left instead of just kind of, if you have your heart set on a school, and that's fine, but definitely don't be afraid to branch out, because that's what him and I did. And it's, like I said, been successful for us so far.
Great. Well, I want to thank you both for taking the time, especially when knowing that you have an exam the next day. We really appreciate all of the information you've shared with us, and that you've been able to help students in this way. If you joined us late, the webinar will be available for viewing on YouTube. We'd like to extend our gratitude to Michael and Amber, and I apologize for the noise in the background here, but we'd like to extend our gratitude to Michael and Amber for taking the time to answer questions this evening. We also wanted to remind you that we have lots of donor-supported tools and resources available on studentdoctor.net to help you with your journey to becoming a healthcare professional, and we invite you to check them out. In particular, we have a how to get into physical therapy school item that we can share the link to in the comments for this webinar, so you can see that. And that's something that will talk a little bit about the process of getting into physical therapy school and go into a little bit more detail on what Michael and Amber have spoken about. So again, thank you again, Michael and Amber. We really appreciate it. And we thank everybody who has attended, and we hope everyone has a great evening.
Thank you, guys. I actually
Thank
just saw
you.
one
Sure.
comment
Sorry.
pop in. I just saw one comment pop in real quick. John had a comment talking about how first year is difficult. So what kind of study habits were best? First year is definitely difficult. I wouldn't say it's one of the hardest years just because you are trying to kind of figure out what works for you in the graduate level. I think the study habit that worked best for me was really just rewriting my notes. That is a way that I was able to kind of really pull the information into my brain and just kind of solidify that information. But another thing that we kind of had touched on earlier in the live chat is that study with partners. It is way different studying on your own than being able to talk to someone about it, being able to act out different gait patterns that you maybe are like, I don't know what this is. I don't know what a crouch gait is. And I don't know what this is. And really having someone there to bounce ideas off of is really important, because studying on your own it's good for some things, but more classes where you have to apply the information, it won't do you any good studying on your own.
Sorry, I'd muted myself, but thank you very much again. And thanks for picking up that last question. And we appreciate your time. And again, if anyone has any, wants to learn more about the process for applying to physical therapy school, we invite you to check out studentdoctor.net. And again, thank you, Michael and Amber.
Thank you.
Thank you for having us.
Okay. And have a good evening, everyone.